Good morning everyone. I am Dr. Sunil Patil. I am consultant urologist and andrologist at Athayu Urocare Center, Thane. Today I am going to give a brief information about prostate gland and TURP surgery. So prostate gland is basically a small pear-shaped gland which is situated in the urinary tract. So what lower urinary tract, it contains urinary bladder, and from there a pipe goes down, which is called urethra, from where urine comes out. So the prostate gland lies just below the bladder and it encircles the urethra in a circular fashion. The main purpose of prostate gland is in reproduction. It helps in semen formation, which is helpful in reproduction in the early ages of your life. But after the age of 45 or 50, the gland usually enlarges in size. So in some patients it may enlarge to a smaller extent. In some patients it may enlarge very rapidly to a larger extent, whereby it may reach up to a size of almost 100 grams also in some cases. The normal size of the prostate is 15 to 20 grams. So the prostate, if it enlarges into the urinary tract and it compresses the urethra, whereby causing blockage of the urinary tract. If the blockage persists, patient may start experiencing symptoms like urinary urgency, urinary frequency. You may have to strain while passing urine, or whenever you have to go to pass urine, you have to wait for some time for the stream to initiate. And in late stages, the patient may have complete blockage of the urine, which requires urinary catheter insertion. So the treatment for such prostate enlargement patients is usually medical management as a first line, whereby patient is started on a medication which is a single tablet which has to be taken, one tablet daily at night. And usually almost 80 to 90% of the patients, they respond very well to such medications, and they may continue with the medication for years together and they may not have any symptoms at all. The medication also helps in preventing further growth of the prostate gland, and it may help in the shrinkage of the prostate gland also in the long term if taken for at least 2 to 3 years. But in a smaller percentage of the patients who may not respond to medical management, almost 10 to 20% of the patients, they may need surgical intervention for such. The surgical intervention is usually called TURP, or transurethral resection of prostate, which is the gold standard surgery for prostate. In TURP, a scope is inserted from the urethra from where we pass urine, and then the urinary tract is inspected, what we call cystoscopy. So cystoscopy involves inspection of the urethra, prostate as well as the urinary bladder. The prostate is inspected for the extent of the enlargement, the extent of the prostatic urethral length. The urinary bladder is inspected for any surprise stones as well as bladder tumors, the situation of the ureteric orifices, and the capacity of the bladder. After that, another scope called resectoscope is inserted through the urethra, which helps in cutting out the prostate gland with the help of an electric current. So the prostate gland is cut bit by bit using electric current as an energy, and then the resected chips are evacuated using the evacuator bottle. The extent of the resection depends on the size of the prostate gland, and usually the prostate gland is resected not completely, but to such extent that the urinary passage becomes wide enough so that patient is able to void properly. And after the procedure is completed, a three-way catheter called Foley's catheter is inserted into the bladder, and the catheter is kept usually for 3 days. The patient may remain in the hospital for 3 days, or if he wants an early discharge, he can go home with the catheter on the second day and come back for catheter removal. After 3 days, the catheter is removed and the patient is able to void properly. Post procedure, there may be some symptoms which patients may experience, like in the initial 1 or 2 weeks, he may have urinary urgency, as in the patient has to go again and again to pass urine. Some patients may also have few drops of blood coming out through the urinary tract after he has voided urine. Some patients may experience burning after he has voided urine. This may continue for 1 or 2 weeks. After that, it usually settles. If the patient has long-standing prostate problem pre-operatively, that is before the procedure, for years together he has had prostate obstruction, then after the procedure is over, patient may have urinary urgency, frequency for 1 or 2 months also. for which he may require some bladder relaxant medications which has to be continued for 1 or 2 months, after which the bladder adapts to the surgery and then he may not need the medications at all. Thank you.